Hey, so most of you who have been following along or kind of staying in touch with kind of what's been going on would have realized that I have not really put a video out there since week 8, which is about 4 weeks or 1 month ago. We are now 12 weeks post-op, and I haven't had a ton to update on. There's been a few things that have happened, which is why I'll make this kind of monthly video updating you from week 8, 9, or 9, 10, 11, and then now week 12. So in that week 8 to 9, I was feeling some sensations of heat in my lower right side, in the muscle area, and then I did have a spasm or a really sharp pain one day, and then the next day everything on that side was totally normal. That week I was walking probably about 60, 100 steps on average, taking the muscle relaxers and the Tylenol as needed. The pain from the shift that I felt on week 8 had kind of gone and subsided more than it was an issue, and more than it was kind of bugging me the week before. And then week 9 kind of came along, and I kind of started getting back into doing the full physio and everything like that. And between week 9, 10, and leading into week 11, I was doing that consistently. And I would notice by the end of the days and midday, just with the more activity and movement I was doing, my pain would increase on the left side, specifically where I felt that shift, and what to me felt like the bones rubbing together again. But I did not feel the bone-on-bone contact that I did when that shift happened. But it was close. I had the consistent dull pain, but not the sharp pain that came along with that. And now leading into this past week, that kind of bone-on-bone pain and that sharp pain has been kind of coming around more than it was in the previous weeks. So last week I did touch base again with a physiotherapist from Virginia, and I had been doing the exercises every day except for the week or two where I kind of set back and just kind of let things calm down, but then I got back into it full force again, easing into it. And then last week, touched base with him. He gave me a new program. I explained to him kind of the pain I was feeling. He kind of thought it could be SI joints, as after a fusion, those tend to lock up. I didn't really think that was it, because I was fused for already about 2 years, or partially fused with the hardware and everything in there. The mobility and the movement in there was limited to what it would be without that. So I was kind of already used to the fusion in a way, I would say. He did give me a program to work on the SI joint stabilization and also mobilize that area, and then step 2 to my lumbar kind of program that I had been doing already, a more advanced version of that. I did not start that yet. That was last week, but I have been having more left-sided pain, even more so than the previous weeks, just with more movement here and there. So last week I also went and had x-rays done and looked at those, and to me they looked rather normal. Like there was nothing really that popped out at me. It's not like I'm a radiologist or can read images perfect, but I've looked at my images thousands of times, and everything kind of did look pretty similar to me from what they had the last time. So I did actually get a hold of VSI and the surgeon down in the States, and I had an appointment and a follow-up with him yesterday, and they looked at the imaging and said the implants, the hardware, everything looks really good, which is positive. And both the surgeon and the assistant kind of said that this is a little bit confusing as to why this has happened. They asked, like, what was I doing when I felt this? Was there a slip, a fall, a twist, a lift, a whatever it may be? And the frustrating thing for me is I almost wish there was something like that, but I've been doing everything within restrictions, limitations, and just everything that I needed to be doing in order to get the progress and to have the fusion and everything kind of take place as it needs to be. And unfortunately, it's kind of seeming like that shift that I felt is kind of leading towards an issue on that left side. But yeah, as I was saying, the imaging looks fine. They're a little confused, and the surgeon did say that he's had this happen one other time with a fusion where, for whatever reason, the person was doing well, I believe, and then they just had the pain kind of come back, and they actually had to go back in and resect part of that bone out. We're not at that point yet. We're going to do a little more digging into what this is. He's really eager to find out what the cause of this is and maybe what caused that kind of shift or the pain to kind of come back. So I am in the process of getting some more CTs and MRIs, and I will send that down there. I'm going to get a little bit of a steroid pack to kind of help calm down the inflammation on that left-sided area. And yeah, we'll go from there. I'm not sure really what else to update at this point. It's not the typical video that I put out there, and there, I guess, is kind of reason now, you know why I haven't really made anything in the past kind of 3-4 weeks. Mentally, this does kind of take a toll on you. Try to stay as positive as you can, but when you've had 2 surgeries in the past have altered this, and you now kind of get to the third and it's nowhere near as bad as it has been, but I could see this potentially being the start to that pain increasing. So I'm going to try and get this figured out with the help of the surgeon. We're going to kind of dial in on maybe what the next step is here, and I'll continue to do the physiotherapy. I'll take that new steroid pack to help calm down with the inflammation and whatever's going on in that area. Get those imagings done as soon as I can, and yeah, I'll touch base with you guys. Kind of unfortunate. I do want to say that I still am feeling better than I was pre-surgery. I don't have 4 screws loose in my spine that are causing me pain. The mobility in this joint, if that is what it is a lot minor and less movement than there was before. So it's not as constant to have the constant dull pain, but those sharp pains kind of only happen when I am more active and mobile. So I'll check in with you guys in the next week or 2 or something like that, and we'll see where to go from there. If anybody wants to let me know, like, would you rather me to do weekly updates and continue with that, or do you just want every 4 weeks or monthly? Leave a comment. I'm not sure what people like. Sometimes I feel there isn't a whole lot to update, so I don't really put anything out there. But if people are still interested and maybe this does help them and they really want to follow along, I have no issues doing the weekly update, even if they are short. If it's something that you guys are interested in, let me know and I will do that. But for now, that's kind of where we're at. I'm trying to figure this all out and deal with it, but it is really nice to have a surgeon kind of really want to figure out the cause of what's going on and kind of help me find the solution to that. A lot of times when I would go to a surgeon or a doctor here in Canada, they would say, this is all in my head. There's no reason for it. Sometimes people just have that pain. And the fact that I have somebody willing to continue to look into this, and not just with my pain, but before we even started talking about the pain, he asked me how I was doing mentally, and that's not something that I've ever experienced here in Canada. So that's pretty nice. But as I mentioned before, I will kind of see what's going on, get the imaging, and yeah, you guys let me know if you want me to keep doing the weekly updates or monthly, and we'll check you guys out another day. Take care. Bye.